Welcome to the Fire and Earth podcast with your hosts, Jason Mefford and Kathy Gruver. Fire and Earth, giving you the keys to unlock your limitless potential.
Welcome to another episode of the Fire and Earth podcast. I'm your co-host, Jason Mefford.
And I'm Kathy Gruver, and I'm sure we've all had an experience, Jason, if you're anything like me, where we're like, oh gosh, I have a pain in my neck, or I have a pain in my butt, or I have this uneasy feeling in my stomach, like I can't stomach this, or like someone's getting under my skin, or I have to put that, the good foot forward, or whatever it is. We've all had these experiences, and I figured out for one of my books, like 80-something phrases like pain in the neck, pain in the butt, I can't stomach this, weight of the world on my shoulders. There's a lot of phrases like that that connect the mind and the body. So that's what we're going to talk about today.
Well, and I think it's fascinating because, like you said, it's and I'm sure you'll talk a little bit about this, but the pain in the neck one, I've heard this so many times, right? Is somebody comes in, they're complaining about a pain in the neck, and I've had this pain in my neck for so long, and then it's like, well, who or what is the pain in your neck? And It's like you figure it out, and boom, the pain in your neck is gone.
Yeah.
Right. Because we'll, I think we're going to pull in some different things because you've obviously done a lot of work on this, written books on it. Before we started recording, we were talking about Dr. Sarno. So we'll probably pull him in a little bit because, I've always had different back pain. Right. And it's pretty common for people to have back pain. Mm-hmm. It's usually nothing physical, but it's this mind-body connection. And there's different places in our body where we hold things, and everybody's different. For me, It's usually in my back, sometimes in my neck, but usually there's about 2 or 3 places in my back where I feel it. And those of you listening, you may be the same way, right? You feel certain places in your body, and they may become kind of a little bit chronic. So we'll go through and talk a little bit about this and maybe some ways of how you can actually release some of these things.
Yeah. Gosh, so many stories about this. So the very first one that actually sort of turned me onto this mind-body medicine, the mind-body medicine thing. Medicine? It's early, folks. Just give me a break. So I had always been into Louise Hay and her little blue book where she had these correspondences of what was happening in your body and what emotions went with that. I wish I had her book close by because it is such powerful stuff. And I remember even in college flipping through that, and I literally circled all the weird things that I had happened and looked at the correspondence, and literally every single one I went, yep. Lungs, asthma, grief, yep. This and the, da 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 da. But so I had a client in my office. She was coming for weekly massage. She had carpal tunnel-like symptoms. She was not diagnosed with carpal tunnel, but she was clearly having problems. This woman so wanted to get better. She was taking her anti-inflammatory. She was getting massage every week. She was doing her stretches. She changed her workstation. She was wearing the brace at night. She was doing everything right physically. And after about the 3rd week, I was making no headway with her at all. And it was driving me crazy. I was, I'll admit, taking a little too much responsibility for her healing. It's like I felt like I could fix her, which as a therapist, we can't do. But I was young. So I'm working on her arm, and I said, oh, okay, I said, I'm clearly missing something. I said, tell me again when this hurts. She thinks about it for a second. She says, well, it's when I'm grasping things, when I'm gripping, hair dryer. She goes, I have trouble lifting a bottle of wine. I thought that was horrible. So I had to,
I had
to fix that. But I listened to her words, and she's like, grab, grasp, grip. And I thought about it for a second, and I finally said, well, is there something you're grasping too tightly? Is there something that you need to let go? And I did that with my hands. And she looked at me and she goes, I don't want to let my kids go.
Yeah.
And I'm like, whoa, because I didn't expect her to have an answer, or one that profound. And I said, well, what do you mean? And she then told me the story about how when she was a little kid, her brother had just gotten his driver's license at 16. The first time he took the car out by himself, he was struck by a drunk driver and killed, never came home.
Oh, man.
And it ripped the family apart. Now, I don't have kids, and I can't imagine what it's like to lose a child, especially in that circumstance. Just how horrible. Ripped her family apart. And now her kids were 15 and a half and 14, and they wanted more freedom, and she was terrified to let them go. And so
I'm guessing that they both wanted to get a driver's license too.
Yes, especially the 15 and a half year old was like, I want to go drive. And she's like, no. And I said, wow. I said, I'm so sorry. That's so awful. Have you told them this story? And she said, well, they knew I lost my brother, but I never told them how. And I said, look, I'm not a therapist. And I'm not telling you what to do. I said, but I would suggest you go home and you tell them that. I said, if nothing else, it will explain to them why you have these fears and these concerns. You're not just going to be crazy overbearing mom. Explaining to them that there's reason, there's emotion, there's deep set emotion behind your decisions. I said, that's going to help them understand you more. She's like, oh, that's kind of an interesting idea. Okay. So she comes back the following week. I said, how are you feeling? She goes, oh my God, my hands feel so good. And we did the normal therapy. And then near the end of the massage, she goes, oh, I forgot to tell you about last week. I said, oh, what? She goes, well, I really thought about what you said and I discussed it with my husband. And so we decided, yeah, let's tell the kids. So that night, after she saw me, after dinner, she pulled out photo albums and they sat around and she told them about her brother and she told them very specifically what happened. And she kind of teared up and said, you know, this is why I'm so afraid to let you go because I'm afraid you're not going to come back. And they all cried together and they had this great moment. And from that point forward, her hands started getting better. So she didn't need to see me every week. It became every other week, then every third week, then once a month. Then I think I saw her one more time and I've never seen her again. Mm-hmm. I don't believe that it was 100% emotional, but when she cleared that emotional thing, when she let that emotion go, it helped. It was the final thing. Now, I do not have a double-blind placebo control that says, yes, it was her letting go that solved the rest of this problem. But it clearly contributed. And I have seen this over and over again with my clients. When they release that emotion, when they acknowledge and process that aspect of their pain, of their discomfort, of their sleep issue, of all that stuff resolves. That's how I got into all of this. I can thank that woman who listened to what I suggested and then shared her experience.
Well, I think that's a great story, you know, for what we're talking about here. Because again, you know, a lot of the time, the different pain that we're feeling in our body, there is some emotional aspect to it, mm-hmm. right? And there's different ways to get through it. I mean, for her going home, having that honest and open conversation with her whole family, sometimes all we have to do is verbalize it.
Yeah.
And what's funny, I mean, one of the guys that I've you know, heard some of the stuff that he does, it's like, you know, some of it you need to verbalize. It doesn't even necessarily have to be using our language to describe it, but just moving your mouth. I think he has, you know, if you don't want to actually say something out loud, just say talking or something like that. Some kind of word, right? To where everything is like, it's like that character Groot from whatever, Guardians of the Galaxy or whatever. All the tree says is, I am Groot, I am Groot, I am Groot, right? But regardless of what it is, sometimes verbalizing or getting it out helps, right? I mean, some of the different therapy options that we've talked about on here, you know, like brain spotting, hypnosis, some of these other things, it's trying to get back into that. You know, for this lady, it was a big T trauma, right? Her brother died unexpectedly, tragically. You know, that's something that she is holding on to, and until she releases that, and it went dormant for a while, probably, right?
Yeah.
Because I'm guessing, again, she didn't have these carpal tunnel like you know, symptoms until her children started getting to that age, and now all of a sudden that emotional experience that wasn't fully processed comes back to the surface, and it's like, you know, hands are going, and there we go.
So I have a funny one. I had a client come in for his massage, and I knew my husband had worked with him. So I knew his work situation. I knew his boss. I knew all this stuff. And he came in for his neck, and I said, so who's the pain in your neck? And I went, no, seriously. And he goes, probably my boss. I went, yeah, it's typically the boss or the spouse. And so I was working on his neck, and I said, so what else is going on? And he goes, oh man, he goes, I have this ulcer. I said, really? Oh, that's awful. I said, what's it feel like? And he goes, well, I get this burning and then it bubbles up every once in a while. Now I'm immediately thinking anger or frustration. That's what it says to me. And I said, oh, that's interesting. I said, so what's eating at you?
Mm.
And he goes, well, it's spicy food. Yeah. No, I know that. But like, what's eating at you? And he goes, well, it's like if I eat and then lay down. He so was not hearing me.
Mm-hmm.
And then I finally said, I figured gestures would help, right? Because I didn't want to tell him what I thought it was. I wanted him to kind of get there. So I said, no. I know, but what is eating at you? And he goes, oh God, I'm sorry. I was totally missing what you were saying. Tomato sauce, onions, garlic. And he lists all these, and I'm like, okay, he's so not getting this. So that was hilarious because it's like, to me, you also kind of have to get there yourself. You can't be like, hey, what if, da, da, da. So then fast forward, I have another client. He shows up. I said, how's your body doing? He goes, I have blood in my urine. And I said, wow, that's really out of my scope of practice.
Yeah.
Massage, not blood and urine, kind of, it's not on my resume. And he goes, oh, no. I went to the doctors. I get kidney stones all the time. I'm sure that's what it is. And I went, okay. So I'm massaging him, and I knew he worked out at the university, and he was constantly frustrated. No one could do anything right. Everybody was stupid, fill in the blanks. And I finally, I'm massaging him and doing his neck, because he also had a pain in the neck. And I said, so how's work going? I said, I know you've been having some frustrations there. And he goes, oh, it's stupid. He just goes on this rant. And I said, oh, so the blood and the urine thing. And he goes, oh, yeah. And I said, so who's pissing you off? And he goes, what? And I said, who's pissing you off? And he goes, oh, I see what you're saying. The blood and the urine. Yeah. No one's pissing me off. And I went, okay. I said, you're not pissed. He goes, nope. Within 10 minutes, he was again back on this rant about how no one can do anything right. He can't retire because he wants to get his full pension and da da da. And I said, wow, you sound really pissed. And he goes, yeah. No. I'm just denying it. I'm not pissed off. There's just this series of little irritations.
Oh.
And I said, oh, like kidney stones. And he looks at me and he goes,
Uh-huh.
yeah. Well, ultimately it turned out not to be kidney stones. It turned out to be bladder cancer.
Oh.
And he did the smartest thing he could. He quit. 2 years before his full pension, 2 years before the full everything. And he did the cancer treatment, and his cancer has not come back that I know. I am not saying he caused his own cancer. I would never say that. I have heard health practitioners say, your anger caused your breast cancer. Oh my God, why would you say that to someone dealing with cancer? Now, what I will say is if you don't listen to what your body is telling you, it will get louder. It's the little kid in the store that's yanking on mom's dress, mommy, and then she's throwing stuff off shelves because she wants your attention. The little things that are happening in your body is a signal that something needs to be addressed. If you ignore it, it's going to get bigger and bigger and bigger, like the crack on the windshield that you swear you're going to fix, and one day you come out and the entire windshield shattered. Address this stuff when it's a kidney stone. Don't wait till it's bladder cancer.
Yeah. Well, and it's funny because, in all 3 or 4 of the different examples that you've shared, there was actually language that goes along with it too, right?
Yeah.
Urine, being pissed off. There's again another, term that kind of comes up. Well, something in our excretory factors, right? However, I'm not a doctor, but something in that area is kind of messed up, which probably led to us coming up with, hey, I'm pissed off, and that's where it shows up.
Right.
Pain in the neck, it's a pain in the butt, sciatica.
Yeah.
Hey, who's the pain in the butt, kind of thing. And what's funny is that, in the examples that you shared, some of the people were still trying to just go left brain, analyze spicy food.
Yeah.
Right.
Onions, garlic, tomato sauce. It was so funny. I just was like, oh, he's so. Yes.
But usually and I think for me, this is where it's hard because, I know this, I get it. And so when I have certain pains in my back, I know I'm holding on to some emotion. There's something probably going on. I don't consciously know what it is, usually, right? And so I think a lot of times we may not consciously know what it is, even if we realize, hey, there's some emotion I've got to work through. There's something I've got to cleanse, purge, whatever word you want to use, right?
Yeah.
And so how do I do that? Or I guess as you've worked with people before, once you start to recognize this, how are some of the best ways for us to try to work through this?
Right. I think it's important to identify what it is. Oh, this is the last example that I'll give you because this is what I do all day. But I had a gentleman in my office. He was having a lot of low back pain. Now, he was a floor installer.
Mm-hmm.
Well, of course he is. He's crawling around on the floor. He's in awkward positions. He's under sinks. He's trying to lay down tile and all this stuff. And he was having pretty bad low back pain. And I don't do this with everybody. But for him, I had this hit of talk about mind body stuff. I don't do this with everybody. Some people, they just played soccer too hard that weekend. It was totally logical that his back would hurt with the job that he has and his age. But I said, hey, just from a mind body perspective, I just want to throw this out. I said, the low back tends to be money issues, sex issues, and personal support issues. He was dead quiet. And I'm like, okay, either he thinks I'm a crazy person, or he's processing, or he fell asleep, or he didn't, whatever. He was a brand new client. And after about 20 minutes, I hear, oh.
Mm-hmm.
And I said, what? And he goes, no, I was thinking about what you said. And I went, oh, okay. And he goes, first of all, which one do you want to start with? I went, that's everyone says. And he said, honestly, I've really been kind of worried about money. And I said, really? And he goes, yeah, this was during the recession and all this stuff. And he said, yeah, he goes, my client load, my customer base is really down. He goes, I actually had to let a couple of my workers go. He goes, and I'm really kind of concerned about it. And I said, oh. He goes, yeah, and I haven't told my wife. Mm. And I went, really? I said, do you think she'd be upset? And he goes, oh, no, we're total partners. She's incredibly supportive. And I said, well, look, I'm not a marriage counselor. I said, I'm not a therapist. I'm not about to tell you what to do. I said, but wouldn't you feel better if you could actually share with her your concerns and you guys could work as a partnership to fix that? He goes, yeah, I should probably do that. So I send him off. He comes back for his next massage and he goes, thank you. I said, what? He goes, I talked to my wife. He goes, I got home that night and I sat her down and expressed my concerns. I expressed my worry. And she pulled out the book. She pulled out the checkbook. She pulled out her savings account. We looked at our budget. He said, and we realized that if I don't get any more clients this year, we're totally fine. Mm-hmm. So it was that thing that feelings aren't facts. Do I know that to be true thing? And he was sort of spiraling from that feeling of lack and him sharing with his wife, which he clearly was feeling a little guilty about not sharing with her, sharing with his wife, looking and actually verifying the books. Because I actually have had my low back go out a couple of times. It seems to be when I'm worried about money. And so what I do is I look at my checkbook and my client load and go, Kathy, you're fine. He said, thank you. That was really cool. He goes, but let me ask you this. I said, what's that? He goes, isn't everybody concerned about money, sex, or personal support? Why don't we all have back pain? And I went, interesting point. I said, are we suppressing that? Are we expressing it? Are we dealing with it? Are we handling it? And even Dr. John Sarno, Healing Your Back Pain, he talks about that. It's those repressed emotions. It's that anger that you're stuffing. It's those emotions you're holding on to. Because emotions, they're ugly. We're not taught how to deal with those. If you put it in your body as physical pain, you pay attention to that. So I think it's another way for our body to process stuff out if we're not dealing with those emotions. How often have we been stressed, and then we get sick, or we get a headache, or we get a stomach problem, or we get... That's what all of this does. That's what our body's trying to do to regulate this stuff. So I feel like it was that talking to the woman's kids. It was quitting the job and getting out of that situation. It was releasing those emotions and dealing with that situation on the physical plane that helped those emotions heal.
Yeah, because really it's not that we don't all experience those emotions, but if we work through them, they kind of dissipate. Mm-hmm. If we stuff them down, if we don't deal with them, then after a while, they will usually end up showing up at different places in our body, right?
Yes.
And I think it's interesting because you talked about, low back pain, money, sex, personal support. That's also your root chakra, area, which does have something to do energetically with money mm-hmm. as well.
Yep.
So it's interesting. Yeah. As far as some of these different places in what it is that, but like you said, we've just got to kind of identify it and then kind of go through it. I mean, Dr. Sarno, he's got that great book, Healing Back Pain. I got it right here.
Book.
Okay.
Yeah.
There's also a documentary about him that's out now that I saw, and just kind of the synopsis of his book, right, is that most of the back pain is not something physically wrong, but it's the stuffing of emotions. And what he saw was that there's a lack of oxygen getting to those certain parts of your back.
Right, yeah.
And because of the oxygen depletion, that's what's causing it. That actually, if you can increase the oxygen to those areas, that it actually starts to go away, and you work through the emotions or the stuff that comes up. And for most of the people that he's dealt with in his practice over the years, he passed away a few years ago, I believe, that tended to be the thing that actually helped them, get rid of it. Whether, they go to their GP and it's like herniated disc, we got to go cut on you and all this kind of stuff. But it's this inflammation in those parts of your body because of the lack of oxygen.
Yeah.
So, again, well, yeah, go on.
Well, I was just saying, and the other thing that he brought up, and I don't remember the numbers, so I'm going to make them up. They looked at 100 people and they did MRIs, CTs, X-rays of 100 completely asymptomatic people. No back pain at all, no back discomfort. And something like, I'm making this up, 50% of them had herniated discs, bulging discs, narrowing of stuff, cracked this and that, but zero symptoms. So if you're starting to have pain somewhere and you go and have this imaging and it shows something that isn't necessarily from the crack, the herniation, the bulging, it could be something else because you have all these other people that have those things but no symptoms. So that's where Western medicine kind of, we solved the problem. It's this thing. And, what we got on this was I'm having neck issues. And Jason immediately said, what's the pain in your neck? Well, I'm having some of those right now. Now, do I have structural stuff going on? I got a shit ton of structural stuff going. My neck it's bad, folks. But it can get better with physical therapy, with me figuring out what those emotions are, me releasing those emotions. I mean, it's what I do, so yeah, but this is how we got this idea for the show is I'm having a pain in my neck. It's not you, Jason.
It's not me.
It's no one that's listening.
Well, and again, for me, like I said, I get various pains in my back,
right?
And they're at specific places. One of those places is low back. But also, some other different areas. And so again, it's just trying to kind of, recognize it, identify it, try to think about, and for me, a lot of times it's like, I don't know what the emotion is that I've got to process through. I don't know what the, big T, little t trauma thing is that I have to work through. I just know there's something there.
Yeah.
But one of the things that I've heard, and this kind of, goes back to some of the NLP kind of stuff, because I know you've actually done some work around NLP too, right? Is, the question that a lot of times you'll hear people say, when they say, well, I just don't know what it is. And the practitioner will say, well, if you knew what it was, what would it be? and usually the first time people are like, well, I just told you I don't know. Well, I know that, but if you knew what it was, what would it be?
Yeah.
And asking ourselves questions like that, consciously we don't know the answer. And sometimes, boom, right at that point, you're like, oh, I get it, right? Like when you're talking to the lady, with the carpal tunnel, well, I don't want to let my kids go. She knew like right away.
That was amazing.
Sometimes that happens, just like right away we know, and other times it's like, oh, I don't know, right? So you ask yourself some of those questions, kind of self-coaching, if you will, and then just let it go. And at some point, your brain is going to tell you what it is. Right. It might be one of those shower moments or whatever else, where just out of the blue, it's like, holy shit, yeah, I totally know what this is now.
Right.
Well, and you can actually try to deal with it.
Right. And it's so funny what we know. And I think so many times when we say, I don't know, we totally do. We just don't want to say anything. I was sort of casually, I was at a party and we were talking, somehow it was all women. So we got on sex because, that's what women talk about if you didn't already know. And we were talking about like experimentation and like BDSM and like all this crazy stuff. And the woman says to me, oh, I'm so not comfortable doing that. And I said, why? And she goes, well, I don't know. I said, yes, you do. She goes, well, I think it's probably, and she goes, so the rest of the night, anytime she'd say, I don't know, I'd say, yes, you do. She had an immediate answer.
Yeah.
Whereas her go-to thing was, I don't know. Yes, you do. Well, it's probably, and she would have this whole, So by the end of this conversation, she was ready to go home and put on lingerie for her husband. Like, good, no, I'm serious. I mean, that was the block, because I was talking about things that I do. Anyway, and she was like, I can't do it. Why? I don't know. Yes, you do. Okay, sure, I do. But it was amazing. It's like she just had to be challenged to answer that question. And what does Mike Mandel say? Pretend, and then pretend you're not pretending. And your brain goes, what?
Well, and that's why, because I think that knee-jerk reaction to I don't know is I don't know consciously is what we mean.
Right. Or I don't want to tell you.
Or I don't want to. It's either I know consciously and I don't want to tell you, or I don't know consciously. Right. Well, you might not know consciously, but subconsciously, your brain and your body knows. And so if you'll actually listen and allow the answer to come back, because I've even seen this with people. I mean, the power of asking questions is great. I mean, that's where, again, a lot of the value comes from coaching and other things like that, is somebody actually asking you the right kind of questions so you can get your own answer. And I've seen people that'll do this where, like, they're talking along and they're like, oh, that guy that did that back pain book, what's his name? I can't remember. What's the guy's name that did the back pain? Oh, Sarno, that's right. Okay. And just kind of asking yourself little things like that ends up, like I said, I've seen this, and it wasn't a coaching thing. They were just trying to remember, but as they were frustrated, they couldn't remember. But the minute that they kind of asked themselves a question, poof, it comes out.
Because your brain doesn't like open loops. Your brain doesn't like mysteries. This is why we can still think about, from 20 years ago, did that guy cheat on me or not? Because we don't have an answer, so our brain's going to keep working on that. That's why at 2 o'clock, we're like, what was the name of that girl that sat next to me in English class? And you don't, in 2 o'clock in the morning, you're like, oh, Beth! Your brain is going to keep working on that until it figures it out. And that can drive us crazy, because sometimes there's no answer. We'll never know if the guy 20 years ago cheated on us. We won't ever know that.
Well,
we might,
and it doesn't really matter 20 years.
Right. But to our brain, it does, because it needs to have closure on that. It needs to figure that out. Anyway, I don't think he did. And Beth's really great. She says hi. So, so ask yourself those questions. Look at the problems that you're having physically and see what corresponds to that. Get Louise Hay's book. I love her little book. John Sarno's book. There's so many. In my book, I have a whole list of correspondences in there.
Yeah, you've written a few books on this too. So
yeah. But I think I came up with 80 or 85 different body languaging things that we use. So it's kind of fun.
Yeah.
That's it.
So, and again, this is not, we probably should give a little disclaimer thing too, right? I mean, obviously, if you have physical symptoms and stuff, you should go see a doctor.
Please.
But like I said, there's been a lot of research and a lot of things that have come out that a lot of times it's not necessarily something structurally that's causing the pain. And so when that's the case, again, try some of the different things that we've been talking about, because they work for lots of people. I mean, you've heard several examples that Kathy's talked about, some of her clients, and how some of these techniques have helped them. So
they're amazing. So we're not physicians. We're not saying you caused your own pain and disease. We are not saying never see your doctor again. Be smart, people. Come on. But, and if this helps improve everything, even by 10%, why would you not do that? So anyway, so there it is. Go forth, examine yourself, look at your own bodies, see how that's connected to your mind, because I guarantee you it is in some way. So that was lovely. I like that. Was a fun one. Okay. I'm Kathy Gruver. I can reach to kathygruver.com.
And I'm Jason Mefford. I can be reached at jasonmefford.com. So go out, ask yourself some questions, work through whatever you need to work through, and, get rid of those pain in the neck and pain in the butt, and stop being pissed off so much, right? So here we go.
And go have sex.
And go have sex so you don't have lower back pain.
Yay!
All right.
I love
there we go. All right. And we'll see you, on the next episode of the Fire and Earth podcast. See ya.
See ya.